The burden of tuberculosis is still high in the country, with a number of unidentified cases in the communities threatening the national target of eradicating the infectious disease in the country by 2030. Advanced screening and new diagnostic equipment introduced by the Ministry of Health through the National TB Program aims at early detection and enrollment to drugs in good time.
Namanga town in Kajiado County is one of the towns with a high risk of tuberculosis infection. The border town that hosts the Ma community has had challenges of testing for the highly infectious disease, especially from remote areas. Truenat machine, one of the new tools launched by the Ministry of Health through the National TB Program, is expected to improve the TB surveillance in this region because of its delivery speed of less than an hour.
We are still missing about 40% of TB cases in the country because we have been using diagnostic techniques that have not been very sensitive. We know we have the gene expert tests, they are sensitive, but they require to be stationed in a place where we have stable electricity. So that tells us that we may be missing other cases right in the community.
When there is a power shortage or power outage, the Truenat machine is able to charge itself and be able to store its charges, its batteries up to 8 hours if they are fully charged. So you can still be able to run samples and give patient out results.
The machine that has been approved by the World Health Organization could be a game changer. Healthcare workers say it is more accurate and efficient.
This tool is going closer to the people, so they are able to access it at a very, not very costly opportunity. And so we ensure that we reach out to most of the people, and in this way we'll be able to get all the cases, and mostly the cases that we have been missing from TB.
Okay. With the Truenat, it's more specific, and even if the sample has a very low bacterial load of the MTB, you can still be able to detect via the PCR machine compared to the microscope, where you are using your naked eye to see. You cannot be able to, you might miss. That test takes around 60 minutes. So after 60 minutes, it's going to give if it's reef resistance or if reef resistance not detected.
Kajiado is among TB high-burden counties. The government selected the border counties and counties with challenges of road accessibility and poor infrastructure.
Kajiado County is very vast, and accessibility of roads and health facilities is an issue, and electricity supply. We are starting to see the impact where we are getting a lot of positive results, and where they are not positive or any other differential diagnosis, they are being treated and taken care of.
According to the government, rapid and sensitive tuberculosis diagnosis closer to the patient is key in TB control. Namanga Health Center at the border of Kenya and Tanzania is one of the periphery facilities to benefit from the new tools. It aimed at eradicating TB in Kenya by 2030. Emily Chebet, Citizen TV, in Namanga, Kajiado County.